And without further ado, our speaker this afternoon is the amazing Dr. Simone Rubin. She received her BS from Ramapo College and went to Alabama College of Osteopathic Medicine. She did her residency at Christ Hospital and Ocean Medical Center for Family Medicine. Thank you so much, Dr. Rubin, for joining us this afternoon. Take it away.
Thank you so much, Danielle. Thank you, everybody, for attending or watching this virtually. It's my pleasure to be here today. I think it's really important that as moms, you kind of check in with yourself. You're always busy taking care of other people and doing things for other people, not remembering to take care of you. And I actually heard a funny story earlier today from a patient who is a mom and a grandma. And she said her daughter is taking care of 2 sick kids at home, but herself is sick. And she keeps forgetting to take her own antibiotic because she's worried about her 2 children who are sick and needing their antibiotics. So as a mom, the work is never done. And now, even though her mother is now a grandmother and raised an adult child, she still is checking in with her daughter to make sure that she's taking her medicine and taking care of herself. All right. So that's just kind of a little precursor of what we are trying to avoid, which is kind of forgetting to take care of ourselves. And we can start the presentation. So if you want to go to the next slide. This is just a little blurb about me. Again, as Danielle introduced me, and I am a family practice provider in Rochelle Park. I do family medicine. I focus on holistic approach and the mind, body, spirit, as well as traditional medicine. I do a little bit of everything. I like dermatology. I like taking care of pediatric patients. I do some of my own gynecological exams. So try to make sure that I take care of my patients in a number of different ways and kind of make it a one-stop shop for my patients and their families. All right, so you can go to the next slide. So if you go back one, I'm sorry. Oh, wait, go ahead. All right, so this is just a reminder for us as, you know, moms, we're busy, but I like to use this analogy. So anytime you're on a plane, they do their safety demonstration and they tell you, you know, in case of emergency, make sure you put on your oxygen mask first before you help others. So kind of the rationale behind any of this is that you need to take care of you so that you can be the best version of yourself in order to take care of others effectively and efficiently. If you're not checking in and taking care of your own basic needs, you're no good to anybody else. That's when we burn out. That's when we get sick. That's when we forget to take care of us. And that way we're no good to our family. So you can go to the next slide. All right. So as any busy mom knows, time is really of the essence. There's never enough time for everything we want to do. I wish there were like 28 hours in a day. There's not. And by the time the kids go to bed, they do their homework, you know, you have to do all the responsibilities of the house, make sure you take care of everything else. You never really check in with yourself. But if you don't take care of yourself, you might do more harm than good. This all leads to stress, burnout, and if you really are burning the candle at both ends, you're going to get sick and you're not going to be able to fulfill all of your obligations that you need to do. So taking a few minutes a day, taking a day for yourself here and there, all of these things are kind of important to make sure that you're taking the best care of you so that you can fulfill all of your obligations and take care of your family and your home. So I came up with 9 ways to get you started of how to take better care of yourself as a mom. So we can go to the next step. All right, so this is your reminder, put on your own oxygen mask. Okay. So these are some tips and 9 essential ways to take care of yourself and check in with you. So we'll start with number 9. Well, number one, really. Get your body moving. You have to get your blood pumping, get something going in yourself, get outside, get refreshed. And depending on what your level of fitness or your level of comfort is, these are a couple of things that you can do to just get your body moving. Take a walk around the block. You can do some stretching or some light yoga. If you're a cyclist, make sure that you're wearing your helmet, but get out on your bike and go for a spin. You can train for a 5K or a fun run. There's a ton of really fun things you can do. You can get your family involved, even if you really don't want to take time away from them, but you need to make sure you're checking in with yourself. And then something else I really like, especially when the weather is helpful, which it is today, it's beautiful out, spend time in nature. Go for a walk, go to your local park, go to your backyard, and just take some time for you. You can take some deep breaths and make sure you're checking in, but make sure you're getting that blood flowing and that heart rate up to get yourself a better fitness level, get yourself in the best shape that you can. It doesn't mean that you need to spend 90 minutes a day, taking a kickboxing class. Take 5 minutes just to do something for you. Go ahead. You time, all right? So make sure that you're doing something that you like to do. If you like taking baths, set a bubble bath for yourself. Light some candles, put some music on. If you really like, you can have a glass of wine. This takes no time. Get the kids to bed. Take 20 minutes just to soak in a bubble bath and just enjoy time with yourself and your own thoughts. If you have a whole day, you can plan a spa day. That means either going to a spa, you can do something for yourself that's a spa, paint your nails, do a facial at home, take a nap. A quick 15-minute, power nap really does the body good. They found that the studies show that 15 to 20 minutes of a nap can really just energize you and be able to get you through the rest of the day, the rest of the night, and all the other obligations. When you're running groceries, you run into the store, buy yourself flowers. Get something pretty that you like yourself. It could be your favorite flower. It could be something that's on special. Get yourself a plant. Just get yourself something nice while you're out. And like I said, it doesn't have to be an expensive spa day. I know that as moms, we put ourselves as the last priority, especially with finances. But there are a couple ingredients in the fridge that you can make a beautiful facial mask for yourself. And you can really check in by just doing that at the end of the day. Okay. Number 3. Friend time. So I know we don't make a lot of time for our friends. We're always looking at the calendar and saying, oh, I can do this in 6 weeks. Oh, that date doesn't work for me. But checking in with friends is really important. Remembering that you have a life outside of your family. You have an identity outside of a family. Have lunch at a new restaurant. Pack a lunch and go meet a friend on a park bench. Make a walking date, and that'll include, getting the body moving, being in nature, and also spending time with a friend. You don't have to spend any money. You can go to the mall, walk around, take a look in the windows. You can join a group and volunteer. You can join a book club or a mom's club or learn some kind of new activity that you want to do, and you can do it with a friend. So you can kind of kill a couple birds with one stone. All right, number 4. Try something new. All right. Try something that you have never done before. You can take yourself on a date and go sightseeing in your own town. You can do something adventurous like taking a rock climbing class or, just rock climbing at a local gym. You could do something, exciting like that. Or you can do something like just journaling. If you've never journaled before, sit down with your own thoughts and write things down. Or you can take a class. I know a lot of moms who, when their kids get a little bit older, they have a little bit more time on their hands and they can take a class. There's a lot of free things that you can do. You can go down to Bergen Community College and audit classes. There's a lot of different ways that you can get involved and do something new for yourself. Number 5, take care of your mind. If you're not keeping your mind fresh, you're going to realize it down the line. You're going to forget things. You're going to forget words. Check something into your mind daily, whether it's I do Wordle in the morning. It takes a couple minutes. You do that and have a cup of coffee. You're taking care of your mind. You're challenging yourself. Do a jigsaw puzzle. Puzzles are shown to keep your mind, up and going. You don't have to do a jigsaw puzzle. You can do a crossword. You can do a word search. You can sketch something from memory that you love. You can read a book and just get the mind flowing, and then meditate and check in with your own mind. Don't forget to think and to take care of the mind that takes care of you. Number 6, get back to it. So doing something that you used to do that you forgot or put on the back burner, an old hobby. You can try cooking something new if you like to cook. You can try cooking something that's an old recipe that you really love to eat. You can get back into a sport that you used to love that you forgot or you don't make time for anymore. You can take a hobby that you used to enjoy before. You can take a class in something that you used to really like doing, before kids, before marriage, before house, before all of the things that got busy and piled up. And don't forget, if there's an old instrument or something that you really neglected and you really used to love to do, pick it up every once in a while and just keep it fresh. Number 7, let it go. Sometimes we're so worried about what everybody thinks, we forget to think about nothing. Sing something loud. Go in your living room and scream, sing, dance, host a game night and get silly. Go see a comedy show or put something on Netflix and watch something that makes you really, really laugh, belly laugh. Just let it go and be you. Don't worry about what anybody else thinks. Just check in with yourself. Number 8, plan to get healthy. All right. Sometimes this is the easiest thing to forget. We get so busy, we want to be healthy, but we don't plan in advance. A plan to fail, or I can't think of the term right now, but because this is also, the brain that I didn't check in with today. You need to make sure that you're planning to do something or you're planning to fail. Fill your pantry with things that you like to eat, some healthy snacks, so that when you are hungry, you're not grabbing junk like Oreos. Grab healthy teas, healthy snacks, stock up on some basic self-care items that you need to make sure that you're keeping healthy, like sunscreen, lotion, medications, cough syrups. You can get some nail polishes or essential oils, things for a bubble bath. Like I, stated before, you have a couple minutes, take a bath, do a facial. If you have all these things on hand, you're going to be able to use them when you actually have the time. And then find a space that's just your own, that you can keep your comforts around with your favorite blanket, your favorite pillow, your favorite book, a candle that you like, a scent you like, and just go there for like a quick pick-me-up. And number 9, which I think is one of the more important things too, is actually be healthy. Make sure you're not forgetting about yourself. There's so many women that come to me that haven't been to a doctor in like 5 years. And they say, well, I've been busy taking my kids to the pediatrician. I've been busy doing this. I've been busy doing that. And they haven't had blood work done or been seen by a doctor in years. So make sure you see your primary care doctor. Make sure you go for your gynecological exams. Make sure that you're up to date with all your screening. So women over 40 should be getting mammograms, annual gynecological exams. Women over 45 should be getting colonoscopies. Make sure that you go to your eye doctor, your dentist, and just check in with you. And these are really the 9 tips that are essential for just checking in with yourself. Make it your own, but make sure you put on your oxygen mask. All right. Don't forget to ask for help. We're all in this together. It takes a village. And make sure you're checking in with yourself often. If you're not checking in with you, then who's going to? All right. I'm open to any questions. And I know that Danielle had some questions for me, but if anybody else has questions in the Q&A box, make sure that you send it my way.
Fantastic. Oh, you disappeared for me. But we do have some questions that came in. One that is like,
Okay.
me too. You need to answer it for me also. How do you get rid of the mom guilt? So you said take time for yourself. And I totally agree with you, but how do you take time for yourself when you're feeling it just automatically makes you feel guilty? Hello? Uh-oh. Oh no. Did I lose everybody? Maybe I just lost. Oh, she's logging back in. All right, she's logging back in. Hold on. Oh, she's muted.
We froze. I'm so sorry. All right, go ahead.
So how do you talked about taking time for yourself, which is so important. What would you say to somebody who says taking time for themselves just makes me so guilty? Mom
Well,
guilt
like I
is so
said,
real.
yeah, mom guilt is real, but if you don't take care of you and you get sick, then who's going to take care of the rest of the family? So the guilt is, oh, I'm not doing enough, I'm not doing enough. But actually, part of taking care of your family is taking care of you and being the best version of yourself to show up for them.
Couldn't agree more. You had mentioned during one of your slides to go on a walk. And so Thrive actually, I'm going to do a plug for Thrive. Thrive has a Wednesday morning, every Wednesday morning, 9:15 walking group. Right now it's at Paramus Park Mall. All are welcome to join us. Once it gets a little bit warmer, we'll be outside. And so, yeah, join us for our Mommy and Me walking group. Okay, another question. And moms, if you have more questions, send them in, put them in, and you can be entered to win our raffle basket. Okay, something that I think is so important for everybody to know is what is the difference between a DO and an MD?
So this is actually a great question. And there was just an article that was written by the Cleveland Clinic about what an MD and a DO are and how they differ. So we basically do the same job and we're very similar. We go to 4 years of medical school. We can prescribe medication and practice all over the United States and other countries as well. But as a DO, we're kind of taught to check in with mind, body, and spirit, which is kind of why I applied that to my lecture today. And not a lecture in a way I want to scold you for doing something, but in a way to remind you to check in on you. So part of being a DO is checking in with the whole person. It's a little bit more of a holistic approach to medicine. As doctors, we do use medication, but I also try to emphasize the relationship between the mind, body, and spirit. I treat a person as an individual, as a whole. We try to improve wellness through education, prevention. And as an osteopathic physician, I also am trained in 300 extra hours a year of medical school of hands-on training to help diagnose and treat a patient. So many patients tell me, I can't believe it, you're the only doctor to ever touch me. I try to put my hands on them. It's a comforting thing, but it's also a diagnostic tool. I can feel areas of stress and tightness in muscles. I can feel a malalignment in the bones. And sometimes I can use my hand to actually put the body back into its best form so that the body processes can take over and you can actually self-heal. It sounds a little bit kind of crunchy granola, but obviously we use modern medicine as well. And it's kind of a combination of different philosophies, and we're tying it together to make the best version of you. So kind of one of the ways I like to explain it is when you go to your dentist, you don't really know if they're a DMD or a DDS. There is a difference. But as the general population, it doesn't make a difference. They're still a dentist. And that's kind of what an MD and a DO are. But I do know that a lot of people that go to a DO, they believe that, they really like the way that they practice and people seek us out.
an awesome question that I have myself. Are you taking on new clients for primary care? I love your approach.
Yes, I am. We are open. I am in Rochelle Park. I just joined the practice in August, so I am taking new patients. I would love to be there to take care of busy moms who want to make sure that they're the best version of themselves. And I take everybody pretty much. I'll even see pediatric patients. I won't do general wellness exams, but we'll do physicals for sports, things like that. I don't really do more of the vaccination schedules that smaller kids do, but I like to take care of whole families and from, kids who are 12 to people, all the way through their whole lives.
Awesome.
So yes, come me in Rochelle Park.
Another great question. And you guys are like reading my minds. I struggle with all these questions too. How can you really let yourself trust somebody else to care for your child? Oh no, we lose her again. Okay. Oh, you're muted.
I don't know what's going on here. I'm sorry. I'm not very tech savvy. How can you trust somebody else to take care of your child? Well, that's a hard question. You have to have a mom gut instinct about a person. So that's big. If you're lucky enough to have relatives in the area, you can trust that they'll be looking out for your child like you would. But honestly, using your community, checking in with people from the neighborhood. I know before I was going back to medical school, I was taking classes and I was babysitting and nannying. And really, it's a lot of word of mouth. So knowing who you can trust to go to and ask for more people that they trust and using that community connection. I think this is a great group too. Knowing that if you need a babysitter, hey guys, who do you use? Would I be able to call them? Ask for help. Check in with other people. And there's a lot of other resources around. So just, if you ever have a question, ask. I have patients who come in and, offer their services. Sometimes they'll leave cards around, not even just for babysitting or childcare or things like that, but just things in the community. And I think that's a big thing, is asking around is probably the best way of finding somebody you can trust.
That's a great answer. I feel like that's the only way, to find somebody you trust. That was great. All right. I do have one more question.
Sure.
So if a mom is struggling with what she thinks might be postpartum anxiety, postpartum depression, how do you suggest they talk to either their OB, their midwife, their PCP? How do they start that approach? Because they might be feeling bad about it. They might be embarrassed. They might not want to talk about it. So how do you start that conversation with your medical professional?
So anytime I have a mom, I like to check in and see how they are doing. They're my patient. They're my priority. And sometimes they forget that they're as important to the whole picture. Without you, nothing happens. So I start the conversation and I always check in with my patients on their mental health. And really part of having a baby, going to GYN, they really should be checking in with you on your mental health and where you're standing. But if you are having thoughts of depression, anxiety, which we all have, suicidal ideations, feelings of you might hurt yourself or others, please talk to your healthcare provider. You are not alone. So many women struggle with these thoughts. We always feel like we're not good enough. We're always trying hard. We don't feel appreciated. These are all normal things that we all struggle with. And as a doctor, as a female, as a person, I'm here to help. I'm here to listen. You're not going to tell me something that I've never heard before. We're only here to help you. So please just be honest and open. And if you are having a hard time, do not be afraid to ask for help.
Awesome. All right. Does anybody else have any more questions? I'll give it a minute. And in my minute of waiting for any more questions to come in, I'll say a tip that I recently started doing. I started reflecting back to my high school Danielle days and listening to old school music. And I'm telling you, I'm like embarrassed to admit it. I've been blasting Weezer, Pandora, and just like getting back into the zone of like finding myself again. And that's been super helpful, and it sounds silly, but try it.
I think that's actually a great tip, and it checks in with something that you love that you probably forgot that you loved, and it brings back a little glimpse of the person you were before you were a mom. So it kind of ties into some of the tips and tricks. And listen, these are limited, but there's countless ways that you can check in. These are just a little bit of a guide to get you back to checking in with yourself.
Awesome. Well, this has been so wonderful. Oh, hold on, we have one more. Yay. Advice on managing irritability and getting frustrated with your kids, and then feeling guilty about that.
So again, take some time for yourself. That way you're going to be less irritable and you're going to be the best version of you. Take 15 minutes and go lock yourself in a bathroom and listen to Weezer on Pandora and put a face mask on, because 15 minutes of checking in with you, you're going to be a better version of you and a better mom. You're going to be less stressed out. And honestly, if you're a single mom, if you have a partner, if you need a babysitter, take one afternoon and just do something for you, because it really goes a long way. Don't think about I know it's easier said than done. Don't think about the guilt, but remember, this is making you the best mom you can be so that you can be better for your kids. So you don't have to worry about feeling guilty that you snapped at them. An afternoon away for yourself is really going to make a huge difference in the parenting and in your mood. And if you really are having a hard time, that's when you come to us, and we're here to help you as medical providers to take care of you and your mental health.
Awesome. And they say, you know what? We get vacation time at work to go and take a break, and then you come back to work even stronger. Being a mom is the hardest work there is. So taking a break from these little toddlers that we've created is probably a good thing. So
couldn't agree more.
Oh, all right, one more. Yay, I'm so glad you guys are interested. Okay, do you have advice on a good way to balance a relationship with your older child and baby so they both feel how special they are to you?
Absolutely. So it's something that I've always done with my mom, and I try to practice going forward. Doing mommy and me dates just individually, leaving the baby, and make it something exciting for the other child. So don't make it a punishment, but leave them with your significant other, leave them with your parents, leave them with a babysitter, let them do something fun and exciting for them. But do a day that's just focused around the two of you and your relationship, things that you like to do together and in common. Growing up, I remember my mom would bring us to school, and she was very big about being, attendance. We would have perfect attendance, or, every once in a while I get sick or whatever, but not taking off days for something silly. So that at the end of the year, when the homework was lighter, the demands at school was a little lighter, she would take, I have a sister, so each one of us independently on our own day date, we would play hooky from school. We would go on a picnic. We would do something that we would love to do together. For me and her, it was always like shopping. So we would go and we would go to the mall. We'd have lunch. We'd window shop. Sometimes we'd get a little, treat or something like that. And then with my sister really liked animals. So they would have a little picnic, and they would go to the zoo, and they would do something fun. And they're memories that I still have with my mom, and they're special and unique to our relationship. But we have a very strong bond. My sister and her have a strong bond. And as a family, we have a strong bond. But that's a good way of kind of balancing it and making sure that you have an independent relationship with each child, not just, the group of you.
That's awesome. Love your mom.
She's the best.
All righty. Well, that's all we have right now. Thank you so much, everybody who joined us, who connected with us. Join us on Facebook, our Thrive Moms Facebook page. I feel like we're trying really hard to connect and build this mom group of women who are non-judgmental and just here to support each other, and things like that. And thank you so much, Dr. Rubin, for joining us. This was amazing and informative and empowering.